We're here today to send a clear message to our Republican colleagues on the House side. Your agenda on women's health is extreme. It breaks faith with a decades-long bipartisan compromise. And according to medical experts, your agenda risks the health and the lives of women. Our other message today is to the women and the families of America. We will continue to defend your health, and with a bipartisan effort, we will stop an agenda that would bring you harm. Now, I'm going to go through a series of charts that really explain what I just said with detail. This is the compromise that has been in place since the 1970s. Roe versus Wade is the law of the land, and as you know, essentially says at the early stages of a pregnancy, a woman has an unfettered right to choose, and after that, the states can restrict her choice, but always the life and the health of the mother must be protected at any stage. Second, no federal funding for abortion, except in the cases of rape, incest, or to save the life of the mother. I happened to be here in the 80s when we had a debate over the rape incest provision, and we managed to succeed on that. And so we've had this truce, we've had this compromise in place for a long time. Third, women can use their private money to obtain insurance that covers a full range of reproductive health care. We believe that people in this country should be free to use their own funds the way they want as long as it's legal. And that has been part of the compromise. This is the compromise that has been attacked head-on by the Republicans in the House. Next chart. The congressional Republican agenda breaks this compromise that I just went through, and it endangers women's health. It's extreme. I explained it ends the compromise. It hurts women's access to health care. It tells women they can't use their private money to purchase insurance that covers a full range of health care. It punishes women in businesses with a tax hike, if they wish to keep or buy insurance that covers the full range of reproductive health care. And it certainly, this agenda of theirs, does not do what the people sent us here to do: create jobs, get our economy back on track, and work together. Now, I'm going to tell you in specifics what we see in these bills. H.R. 3, there's a hearing today on H.R. 3 in the House. This is what it does. Flexible spending accounts or health saving accounts could not be used to pay for a full range of reproductive health care. So in other words, if you have a flexible spending account, there's no government dollars in that whatsoever, or an HSA. It's your own money. You can no longer choose the insurance that you want or keep the insurance that you have if it covers the full range of reproductive health care. Next, people who've lost their jobs because of trade with foreign countries, they get a health coverage tax credit. They won't be able to use their health coverage tax credit to buy insurance of their choosing. And third, the self-employed who deduct health care costs from their taxes could no longer do it if they have a plan that covers a full range of reproductive health care. So again, we are, according to Smith, going to raise taxes on people who already have this benefit. More on H.R. 3. Those who pay health insurance premiums with pre-tax dollars will not be able to buy or keep insurance plans that cover a full range of reproductive health care. And as you know, there are many people who do that. They are allowed to, before they pay their taxes, they can buy their insurance. They will no longer be able to buy or keep their insurance plans. Next, small businesses that receive a tax credit to buy health insurance for their employees will lose their tax credit if they choose a plan that covers a full range of reproductive health care. Tax hikes. The Republicans in the House are proposing tax hikes because they don't like a health plan a private sector business chooses. The District of Columbia would no longer be allowed to spend its own tax dollars on providing women in D.C. a full range of reproductive health care. So the women in D.C. are also punished. We'll go to the next chart. More on H.R. 3, and this is something that nobody has stated up until now. And this, to me, is extraordinary. According to the National Women's Law Center, and by the way, we've had others look at this and they agree, for the first time in decades, there would no longer be a requirement that states provide abortions to poor women who are the victims of rape or incest or need the procedure to save their life. Right now, there's a national rule that says to the states, if a woman is the victim of rape, incest, or her life is threatened, you must, through the Medicaid program, help that woman. This is repealed. This is extreme to the limit. Then, due to restrictions on Title X family planning programs, millions of women would lose access to mammograms, other cancer screenings, and essential health services. That's another bill, H.R. 217. And I want to say to the people here who don't know this, many women, millions of women, get their primary health care through that Title X program. They go in and they get screened, a pap smear, a breast exam, a mammogram, et cetera. They won't be able to do that anymore. Hospitals would no longer have to provide women who need urgent emergency care with life-saving procedures. Let me explain that. That's H.R. 358. As you know, we have a conscience clause, and we all support that, all of us. But there's an exception to the conscience clause that says if a woman comes into your hospital and she's bleeding and she's about to die from a pregnancy gone wrong, you must help her, even if it means ending that pregnancy. Now, a hospital could choose to turn away from that woman. Proposed, and we know about this, they tried to redefine rape and incest for purposes of federal funding, and you know the public pressure that was put on them, including a Jon Stewart. It's sad to me that you have to have a Jon Stewart late-night show get the Republicans to move back, but they couldn't withstand the pressure of redefining rape and incest, saying, well, we'll decide, government, what a rape is. And by the way, if you're a victim of incest, but you're 18 plus 1 day, it really doesn't qualify as incest for purposes of federal funding. Unbelievable. They supposedly backed off of that. We'll see if that's true. So now that explains it, and I'll close with showing you some of the statements that have been made by various groups. Here's what Judith Lichtman wrote, Senior Advisor, National Partnership for Women and Families. It is no exaggeration to say that if these bills become law, women, including mothers, will suffer and die. This isn't about preventing federal funding of abortion services, which was stopped years ago. This is designed to deny contraception and other critical health services to women and to imperil women's lives. Is that what this election was about? I think not. Let's go to the others. These proposals can jeopardize the health and safety of our patients and put government between a physician and a patient. Richard Waldman, American Congress of OBGYN. Next. American Medical Women's Association strongly opposes bills H.R. 3 and 217 as they will further restrict access to a procedure that is legal and should be safely available to all women. And next. Dr. Douglas Lobabord, Chair, Physicians for Reproductive Choice and Health. This is not medicine. This is cruelty.